I think part of good leadership is a commitment to prepare and a willingness to think the unthinkable. So this was like a switch that flipped, because we were in a very ordinary day. I was sitting in my office with my administrator, we were going through some budgets, and all of a sudden her phone and my phone rang at exactly the same time. And I thought, that's peculiar.
I was in Nashville, Tennessee, taking my daughter and my family on a college visit. And we were just about to start the actual campus visit, and I got a call. And the first call was, "Did you hear what's going on?"
I just finished with my clinic, and I'd headed up to my office to dictate my clinic notes, and one of my friends called me up and said, "Can I help?" And I said, "Help with what?" And he said, "There's been a bombing."
All you could hear were sirens. It was insane. Siren after siren after siren. It was constant.
I walked into the emergency department and was completely shell-shocked.
I was the only member of the orthopedic trauma department that was here that day, so I quickly called one of my partners in general surgery, and he explained the situation. I rushed down to the emergency room just as the code trauma alert went out. And so I was there when they brought in the first few patients, and it was pretty chaotic.
Mike Weaver was the traumatologist here, and he started telling me the events of the day, and I said, "Do you want me to come home?" And I heard him pause, and I said, "All right, I'm leaving." It was the fact that he couldn't say no that made me realize he didn't want to say yes, but he also knew that this was something pretty big, and it would be helpful to have more hands on deck.
When Mitch Harris found out the bombing happened, he contacted me because most of the cell phone service was down. When he got through to me, he said, "Make sure you tell John Gates, Ron Walls, and Mike Weaver that I'll be coming in, and I'm happy to help in whatever way that I can."
Every good leader needs help. It can come from somebody pointing out to you, someone who needs something. But most importantly, being a good leader, I think, means recognizing your own limitations and understanding what you can do personally and what others have to do. There is always a period at the beginning of these events where there is almost an unreality about it. Partly because you really don't know what's going to happen yet, and our information on this particular day came in more slowly in relation to the victims than is usually the case, because the victims were so close to us and there was already field triage established. So we had the tent, we had the ambulances, we had the people on the ground, so the victims were out of there and toward the hospitals almost more rapidly than the information was.
These bombing events tend not to happen. And when they happen, they tend not to happen in a major metropolitan area where you have 6 level 1 trauma centers within 2 miles of the event.
Because the proximity of the medical centers was so close, the average time from the scene at time of injury to being seen in the emergency room was 17 minutes. Had the bombing occurred 10 miles away from the end, it would have been a completely different story.
Not only were the bombs located in an area that was almost equidistant from every trauma center in Boston, but also the roads were clear because it was a holiday Monday and the ambulances were already there.
For each operative team that went into the ORs, we had an orthopedist, we had a plastic surgeon, and we had a general surgeon. And Ron Walls was the one who was orchestrating the command center in the emergency room.
Jonathan Gates played a really key role in the communication between the teams rather than the communications inside the teams.
I met with the orthopedic surgeon on call, who is Dr. Weaver, and the anesthesia person on call, who was a very senior anesthesiologist, and together we formed what I consider somewhat of a leadership team in the emergency department to be able to triage patients as to who would need the operating room.
Dr. Weaver was really key in terms of making orthopedic prioritization and helping to prioritize the orthopedic injuries with the non-orthopedic injuries, because the orthopedic injuries here were dramatic. But Mike did a great job in making sure that the prioritization of these emergent orthopedic injuries was part of the care of the total patient and coordinating with trauma surgery as well. So those were key roles that both Mike Weaver and Jonathan Gates played in making sure that the right patient got to the OR with the right team and the right priority in the right order.
I think we're fortunate to work with colleagues that have the ability to remove themselves from the situation and adopt almost like the 10,000-foot view and say, okay, what are the pieces that need to factor into the decisions that are made at this time? Some of these decisions are irreversible, and how do we make sure the proper perspectives are in place to inform these irreversible decisions? And I think we did that really well.
My former vice chair, Rich Zane, is the chair of emergency medicine at the University of Colorado. So after the Aurora shootings, I asked him what happened to them in the hospital after that theater event. And he actually sent me a timeline. And what was really impressive about the timeline was how fast the patients arrived. And I counted on his timeline, and they had 23 patients in the first hour. That's when I really looked back at our drills, and I thought, I don't remember ever doing that. And our biggest number before had been 13 or 14. So after we did the Aurora preparedness analysis and realized we'd only drilled to 14, we started setting our standards higher. We started wondering, what do we need to do to get ready for 23 patients in the first hour, if that's what Aurora got? So we started working on that. We deployed more supplies. We were able to constitute more teams. We did more training of our leadership in Hospital Incident Command. We just got to a higher level of readiness. And amazingly, on Marathon Monday, we got 23 victims in the first hour.
Just thinking that something terrible like this could happen allowed them to prepare better. And if that's not a sign of leadership, being prepared, nothing is more important than that.
And no question, we were better prepared for them because we had taken a close look at the lessons of Aurora.
When you have a major trauma like this, no individual stands out as the leader. The group comes together and performs. And at different times of the day or the week, or in this case, the next several weeks, different people play the role of leader as the days and weeks go on.
One of our residents came in to help, and he still had his markings on from the race. He actually had just finished, and he ran from downtown Boston to the hospital to help. And pretty much everyone that I know here at the hospital either had a friend or a family member that was either running the race or part of the crowd.
As physicians, we have to take leadership roles more and more, and not just in crisis management, but in health policy and advocacy, and advocating for our patients as well as the institutions we work in. So physicians need to want to be in the leadership role, and then they need to learn how their own personality plays into a leadership style, because there's clearly different styles of leadership.
Surgery is a very historically a macho setting. We're not used to asking for help. We're used to considering ourselves as sole players, sometimes in the middle of a maelstrom. We kind of think of ourselves as the strongmen in the circus sometimes. And it's important to be able to realize, to be sensitive to your own set of emotions and to those around you in order to figure out a way that you can coordinate activities and really draw the best out of each other.
We all gravitate toward our zone of comfort, and our zone of comfort tends to be things in which we feel like we are masters. So as long as you are doing that, you're not really going to develop your leadership skills. So get involved in things that challenge you and push you to the limits of your decision making and your experience and your comfort.
Don't lead because you think it's a great thing and you think it's great for your ego or for your career. Lead because you think that when you're all said and done, in whatever position that you are serving, that you have left the organization or the committee or the group better off than when you started.
I don't think leaders are necessarily heroes. I think leaders are people who assume a certain important role at a moment when that is most important. It's people who can rise to an occasion and make something positive out of something negative, or make something constructive and directed and organizationally sound out of something that's chaotic.
It was phenomenal to see how much, compassion there was in the city. There was such an outpouring of support, and anything that anyone could do to help, they reached out. I mean, when you look at pictures of the bombing or the video, people were running to the victims, were running towards the explosions. And, we saw that here too. Everyone, they wanted to help, they wanted to do everything they could, and it was really a time of selflessness. And, and something like this is such a horrible thing, but if there's a silver lining to it, to me, it was seeing the inspiring character of the people that work here and of the city. I mean, it was really amazing to see everyone come together.